Hi guys, and welcome to another Whitney's Wonders. So I have a bit of a different video for you guys today. I wanted to kind of do like a health update slash also a health journey because I'm starting a new medication that I just got recently prescribed. So as many of you know, friends and family, I was diagnosed with Crohn's disease in 2013. So it all started when I had an abscess. Now, abscesses are the worst pain I personally have ever been through. I'm sure other people have been through more painful things, but for me, up to my life here at 34 years old, the abscesses have been the most painful. I've had 5 in total. I haven't had one in a couple years now. I did have some troubles at the beginning of this summer in that area, so I was a little worried. It's still kind of not where it should be, but it's not where it was. So that is kind of under control at this time. So back in 2013, when I first was going through symptoms of Crohn's, I didn't know it was Crohn's at the time. I got very sick. I was scared to eat. I dropped 70 pounds. A bunch of stuff was going on that I was like, holy, what is this? I looked at the scale daily. I dropped like a pound or two and be like, I think I'm dying. I'm definitely dying. I'd be at work checking the scale, and I didn't really talk to many people about it except for like my mom, because I didn't know what was going on. You know, people have their own issues. I didn't want to bog people down with, oh, this is, woe is me, this is going on. So I kind of just kept it to myself, which can be even more scary actually. So once I was diagnosed, there was a lot of fear that, you know, decreased based on I know what it was now and I'm not dying. Well, at least not today. So I figured out it was Crohn's. It runs in my family. It wasn't a big shock, especially when they started talking about it after the first abscess. So that's where my journey started. And my gastroenterologist, Dr. Jones, he prescribed me a medication first called Humira. So there's a kind of medication called biologics that is used for moderate to severe Crohn's disease. So I was a little worried because, you know, out the gate, we're going to a medication that's for severe. So I was a little worried about it. I did all my research on Humira. I read the good, the bad. I'm on Crohn's groups on Facebook. I read people's experiences, side effects, and I made the decision to start Humira. So I don't think it really did much for me. I don't really know what it was doing inside because like Crohn's and colitis, you can't really see the inside, so you don't really know unless they do testing for it. So I think I was on that for like a year, not even a couple months. I think it was more like a year. And Dr. Jones tested my blood. I had developed antibodies to Humira and it was no longer showing up in my blood. So that means it's not working. So next treatment plan we think of. Dr. Jones brings up the idea of Remicade. So again, I started all over again. I do the research. I read into the things. Humira was really easy because it's an auto-injector pen. I should do a video of my meds now actually showing you guys how I do it. Maybe I'll do one like that. But it's just an auto-injector pen, so you can either put it in your thigh or your stomach, and you just click it. It shoots the needle in, gives you the medication real quick. Not very painful at all. And that's where we were. So the Remicade, though, is a 3-hour infusion. So the infusion clinic is near Terrace Hill, across from the hospital. So I would go there every 8 weeks, sit for 3 hours, which was really nice, actually, because they had lazy boy chairs. They'd give you snacks, coffee, tea, whatever you wanted to relax while you're getting your infusion. And there was nurses around just to watch, just in case. Now, the Remicade did wonders for me. I felt great. I was back to exercising again. I was able to eat properly. It was helping most of my symptoms, which I loved because it was a while that it took me to get to that place. So in terms of remission, I'd say maybe for 6 months with Remicade and a pill called Imuran, I had received some type of remission, which felt great because I haven't had it since. But the Remicade with the Imuran was the next step. So I did that for probably about 6 to 8 months. The Imuran then gave me what's called pancreatitis, which is a known side effect for the Imuran. I've had gallbladder problems before, so it kind of felt like a gallbladder attack, but it would like go away through the night, and then as soon as I'd take the pill the next day, then it would start coming back again. So I was like, this is weird. So my doctor told me to stop the Imuran immediately. We did blood work. It checked that I was having a pancreatic attack, and I stopped it. All pain went away as soon as I stopped that pill. So Remicade was good for the time, but like everything else, we tested my blood and it had stopped working. I developed antibodies to Remicade. So that was really actually depressing for me because Remicade made me feel the best, but you can't take it if it's not working, and it's very expensive. I think it was like $5,700 for 8 weeks, and most insurance companies give you a really hard time getting these biologic medications set up, so it is kind of a rigmarole to do it, but they will approve it. And what most people don't know is a lot of these drug companies, they have programs that will help you pay for the other part that's not covered by your insurance. So I am very lucky in that I am able to do that. So we get the Remicade, we start with the Humira, then we get the Remicade and the Imuran, and that was going along fine for a while. And then we switched now, after the Remicade stopped working, to a drug called Entyvio. Now Entyvio is just a gut-specific drug, so it doesn't help with, I was starting to have a lot of joint pain, a lot of just pain overall in my body, and I was thinking to myself, and I talked to my GI about it, I said, this isn't normal. I'm having a lot of pain. I don't think it's just Crohn's. You know, all the things that I was having and experiencing, I shared with my doctor. So he then told me to speak to my family doctor and get a referral to what's called a rheumatologist. So I did that. I got my rheumatologist. She's in Ancaster, Dr. Pavlova. She's wonderful. Highly recommend her. She starts doing testing because there's also another condition in my family called ankylosing spondylitis. So she did an x-ray. It didn't show anything. Then she did an MRI, and her exact words were, it lit up. So I was then diagnosed with ankylosing spondylitis. So that's 2 autoimmune disorders. And once you have one autoimmune disorder, unfortunately, as people who have autoimmune know, you can get more than one, and they come and they start attacking. So that was my next step, ankylosing spondylitis. So another chip in the old Whitney's life block, but we had a treatment plan. Dr. Pavlova was talking about a new medication called Cimzia. Now this one is approved in the States for Crohn's, but not Canada. But in Canada, it's approved for ankylosing spondylitis, but it also helps with Crohn's. I know, I'm going fast. This is very hard to take in. It's hard to keep up. Trust me, I know. But I'm trying to explain the best I can of what these things are and the treatment options. So I start Cimzia. Like everything else, I start it. It makes me feel amazing. I was able to walk properly again because, as most of you knew, when I was in my worst flare with AS, I was hunchback. Everything hurt. I could barely move. I put on weight. It was really, it's hard to, when you're in the moment of these things, because it is a struggle. It's really, you feel lonely most times. Like, I know I have my family, and I have Kyle, and I have all that, but inside it's kind of hard to deal with sometimes in your own head. So I call them the pity party days. Sometimes, I'm sure we all have them. There's just some days where it's a little harder to deal with life that day. I have my pity party, have a good cry, go about my day, move on, keep going. That's really all you can do, right? For me anyway. Other people can deal with their own stuff in their own way. Everybody do what you need to do, right? That's my motto. I don't tell anybody what to do, how to live their life. So I am now on Cimzia. I've been on it since. I'm still on it. So I give myself a needle now. It's actually a syringe that I inject into my stomach. I take 2 every month. So it's helping with my ankylosing spondylitis, but not so much my Crohn's. So that brings me to why I wanted to kind of do this video, because I had a recent colonoscopy, and Dr. Jones has informed me that there's no narrowing, because back in 2017, I had a bowel resection as well. So what a bowel resection is basically there was narrowing of your bowel in a certain part of mine between the large and small intestine. So there was also a fistula there. And what a fistula is just a tunnel from one organ to another, or one thing to the skin where it shouldn't be. So I was then referred to a surgeon at the Juravinsky, Dr. Kelly, and he did my bowel resection. Now, this man has been my savior through all my abscesses and my bowel resection. He has been always so sweet to me. Him and his assistant, Sam, they are amazing. I'll have an abscess a day. The next day, they get me into surgery, having it drained. I feel so much better. So I am so happy that I got linked up with Dr. Kelly at the Juravinsky for this. He did my bowel resection. I was in the hospital for about 5 days. Got out of there because as soon as the doctors told me that if you stay on the morphine, if you're not moving up in that, you're going to be in the hospital longer. So, and they want to make sure you go into the bathroom before you leave just to make sure everything's hooked up properly. So I did my darndest to get out of there because I hate the hospital, hate being in there, everything to do it. I mean, day 1 and 2 is maybe okay because you're kind of, still out of it. But once you start getting your scruples back, you're like, I need to get out of here because this place is going to drive me nuts. So had my bowel resection on the Cimzia. Things have been kind of good since then, but just recently, again, like I said, I had my colonoscopy, and Dr. Jones said there was severe inflammation and a lot of ulceration going on in there. So where my actual bowel resection was, just a little bit down, further down, that's where it is, and also at my rectum. But that's always been where my inflammation is. I've tried so hard to clear that up, but that's why I probably get the abscesses too. I don't know. But he then recommended that I take a steroid called Prednisone. So this is kind of what I wanted to do. So today I started my prescription. I've read all the things about Prednisone as well. The good, the bad, the side effects, the ugly. It's a very daunting steroid drug that I didn't really want to take. I haven't taken it up to this point. We've tried to avoid it, but at this point, I guess we can't anymore. The Cortiment I was just on for a 2-month round is not working. I'm still having right-sided pain. Everything I eat, I could eat a banana or I could eat a Big Mac. Everything is hurting me. Nothing is going through properly. So we're going to try this Prednisone. Now, you start at a certain level. So today I had to take 8 pills, but they're only 5 milligrams, so it's small pills. And then you taper off of it because you can't just stop it, or it could have some really bad side effects from that as well. So I have come to the decision along with my gastroenterologist that I'm going to do this round of Prednisone to see if it helps with the inflammation at all, see if it helps, just bring me back to how I was, the old Whitney. So I'm kind of scared to try it, but I'm going to. We'll see how it is. Some side effects that I've heard is, you can become an insomniac, like it's hard to sleep on it. You get excessive sweating. You can, what else was there? There was a whole list, like it was a huge paragraph of side effects, and then at the bottom they say, this is not everything that it could be. So I'm not one to not just read things that I'm putting into my body. I like to know what's going on. And unfortunately at this point, hopefully that the benefits from this Prednisone will outweigh the side effects. I'm always scared of pills because I always seem to have some sort of side effect. That's just my luck. That's the luck I've been given in my life, but I still power forward. So it was a little weird, and obviously I made a video of my recent colonoscopy. I have it on my YouTube. It wasn't a full day that I got to show because you can't actually show in the hospital, but I talked about, the prep, which is the worst part. And it was really weird this time because shout out to my mother and my grandmother. They have been with me through my whole health journey. They have come to every procedure I've had done, every colonoscopy, every resection. If you know those two, they are a duo that definitely kept my mind off the impending doom of health procedures because they're a show, that's for sure. If I had those two on my YouTube channel, I might get millions of views. Who knows? But anyway, it was a little weird at this colonoscopy because I couldn't have either of them in. Now, with COVID, right? So it's a little scary, I think, for people because you're going in and getting these procedures done and you got to be by yourself. Now, thank God for me, I know what a colonoscopy entails. I've had plenty of them. It wasn't scary for me, but if that was my first one and I had no idea, it'd probably be a little daunting. I'd want my family or a friend or somebody there to sit with me at least because it takes you at least 2 hours from start to finish. But I kind of just wanted to, make a video going over my health journey. There's probably a lot of stuff I missed. There's been so much through the years that I can't even remember. But if you have any questions about Crohn's disease, ankylosing spondylitis, you want to know any more, you know, do some research. Ask me in the comments below. I will answer as best as I can. I love the like and subscribe. You guys have been great with that. But I just kind of wanted to give like a couple videos that I'm going to do going forward as well. Just my prednisone journey. Because a lot of people get prescribed this steroid. It's a very popular steroid. And I just wanted to show if I go through any side effects with it or the good, if it makes me feel great. I want to document that as well for my YouTube videos. So today was prednisone day 1. I'll probably do weekly videos in between other videos that I also do because I've got, you know, other 90s collection stuff I like to do for you guys to show off stuff. But I just wanted to kind of do a video where it's showing what's going on with me, with my Crohn's journey, with the prednisone, and I hope that it gets me out of this flare and takes inflammation down, because that's the worst part. And that's the part that people don't see. A lot of people just think, oh, it's a pooping disease. But Crohn's disease is so much more. And I love how I've got people in my life that are so supportive of me that actually get it. If I'm having a bad day, like there's some days I don't even want to get out of bed. I open my eyeballs, I get up and I go. And I'm learning as I get older to not feel guilty about saying no to people if I don't want to go out and do something because I need to rest. My body needs the rest. And I even have people, oh, you sleep for 8 to 9 hours. I get that. Maybe 6 hours works for you. I need 8 to 9 for my body to rest. So there's been also a lot of people through the years that actually have been quite jerks to me. They really fight and give me their opinion on it. And I go, well, you know, there's nothing I could do. I'm going to choose to live my life this way. So that used to really bug me a lot actually too when I was younger, in my mid-20s, of people doing that. Well, I was diagnosed at 27, so kind of getting into the late 20s. But everybody had an opinion, but they didn't really actually know the disease. So if you're going to give me an opinion, you can, but don't just be like, that's the end all to be all, because it's an incurable disease. So shout out to everybody who lives with this disease or any other autoimmune, because they're difficult. They're difficult. And I just wanted to give you guys a bit of my journey, let you know what I've been through. But it's been years of chronic pain, different diets, different medications, a struggle. I will say it's a struggle. There's some days where it's a very hard struggle, but I keep going through. So I'll keep up the videos, and I just wanted to start day 1 with the prednisone. I'll probably do a week-by-week video just to sum up what happened through the week, if there's anything that happened, if I'm feeling better. We'll see. Hopefully, the right side of pain right now, I'd like it to be gone. That's what I want gone. But Dr. Jones says there's no narrowing, so I won't need another bowel resection. We just got to get the inflammation under control. So we will do some round of steroids. Oh, another side effect too, I guess they call it the moon face, so, and irritability. So for anybody who's out there that knows me and deals with me on a day-to-day basis, I apologize right now if I'm angrier than usual or if my face blows up. Can't help it. But I gave Kyle a warning. He works at the pharmacy, so he already knows the side effects. He sees people with it, right? So if I'm angry with anybody, I apologize. Not my fault. It's the roids. Okay, so that's all I wanted to do today, guys, was to give you a little bit of an update, health update. People like watching sometimes people's health stories, so I figured I might as well share mine. But like I said, there's probably a lot I forgot. But we will see you for the next video, and we'll finish and complete this prednisone journey together. All right, thanks, guys. Talk to you later. Bye.